I'd like to just start first by asking each of you your thoughts on how do we really best leverage innovation in a way to keep the gap between developing and developed economies from growing. We see that there are a number of areas where infrastructure is quite disparate. You have great infrastructure, obviously, in Western economies and developed nations, but in emerging markets where cloud infrastructure is not fully penetrated the marketplace, how do we bridge some of these technology barriers to make sure that as innovation advances, everyone around the world is benefiting from these technologies? Dr. Seth, perhaps we can start with you this morning. I know you've done quite a bit in your work with Gavi previously and in terms of bringing new and innovative technologies to the marketplace during the COVID pandemic through COVAX. What are your thoughts on how we make sure that we don't leave developing economies behind?
Thank you so much, Elena, and it's great to be here with all of you. I think what we have to think about is the equity issue that is infused through all of this, and that is the principle that as we create tools, as we have new ways of working, that we make those available to everyone. What we saw in the pandemic was not an equitable distribution of vaccines. It was better than it had ever been, but it was not what we hoped for. And the challenge is building simple systems at country level to be able to have surveillance for disease everywhere, and then to have product development using new technology, using AI, using other activities, but then making sure those are available, obviously manufacturing around the world, and making sure there's financing available to do that. And, just to give you an example of how some of the advances have gone and not gone, there is a 100-day mission to be able to bring new tools together in pandemics. We had a case in Uganda where we had a case of Ebola Sudan, and they had to use public health approaches because although they had a fabulous public health system, they were able to control their epidemic, vaccines didn't come until after they controlled the epidemic. Recently, Rwanda had a Marburg pandemic or epidemic, and they were able, within 8.5 days, to have experimental vaccines available. That's what we're looking for. We need to be prepared anywhere in the world to make new tools like that available, and I think that's an aspiration that can be met.
Thank you. Dr. Manal, your thoughts?
Well, thank you very much. And actually, when it comes to the use of advanced technology, a key factor there is planning properly, because I represent the humanitarian sector, and we work in countries where there is a lack of infrastructure maturity even for the use of advanced technology. But with the proper planning and with the proper partnership and collaboration, we managed, for example, I'll give you an example of what we've done already, and very successful program is introduce telemedicine in Nepal. And I'm sure everybody's here aware of the geographic distribution of the population in Nepal, where you've got highlands and lowlands, and sometimes with extreme weather changes, it becomes very difficult for villagers and the population there to access good quality health care. So what we did is that we introduced teleophthalmology specifically, and we've linked with electronic medical records around 11 primary care centers with 2 main tertiary care hospitals. And that program is actually now up and running, and it's serving around 11 million of the population in that area. Another project we actually introduced this year was the use of AI for the early detection of complications of chronic diseases. And that also was a bit challenging at the beginning because of certain policies. And we've had the opportunity to discuss this yesterday in a roundtable discussion where certain policies unintentionally are drafted, and they actually restrict the use of advanced technology. So we really have to work on making policies more agile and more supportive rather than restrictive. And I do respect that every country has a concern when it comes to data security, and we all respect that. But a policy should not be extremely restricting that it prevents us from delivering good quality healthcare.
Thank you, Dr. Manal. Dr. Sham, in your role as Minister of Health, I'd love to hear your view on some of the policy pieces that Dr. Manal has just spoken about. Because obviously, Brunei is one of the only countries in Southeast Asia that has universal health care. You've clearly created a policy environment that's facilitating the provision of care across all segments of the country. How are you leveraging that policy environment to leverage also advanced technology in healthcare?
Thank you very much, Anna. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum and a very good morning. As you know, Brunei is a very small country, slightly bigger than Seychelles. And it has challenges, especially in health. The main thing is the human capacity, supply chain. So in order to improve the healthcare in which that we believe health is right for everyone, every human. So we want to make sure, although Brunei is small, with small population, we do have people who live in the interiors, okay? And we developed digitization of our health information system more than 11 years ago. Now, with the pandemic, we have evolved into AI, okay? The use of artificial intelligence, where the health system is now on the phone. About 99% of Brunei population have a smartphone and have access to data. So we use this following COVID-19, de-escalation, where you use the phone to move about here and there. And with the health information system, we collect all this data for these 11 years and use the AI behind it, help us to produce a predictive analysis as well. Okay? So in 15, 20 years' time, this algorithm will help us to predict and help us prepare what are the common NCDs that we're going to have. And it also has this intelligence of communicable diseases. So if there is a sudden rise in certain area, especially with the climate change, now you cannot predict when the monsoon is. There'll be flooding here and there. With this, the vector-borne disease will be more apparent. So we'll have this system as well. So the use of AI in terms of public health and control of especially communicable and non-communicable disease in Brunei is quite important. And we ensure that it's regulated, but as you mentioned, the law is there to make it agile as well. Because we don't want the law to be so restrictive, especially for a country like us, where we need expertise from outside as well to help us to develop this algorithm and preparedness. So basically, the idea is preparedness.
Yeah.
How to make the healthcare resilient. Preparedness from now on is very important so that the next generation would not blame us for failing to prepare.
Thank you, Dr. Sham. And I'd like to come back to this topic of resilience in just a minute because I think it's a very important one and something I've spoken about with each of you over the last weeks. But Dr. Luba, you've worked with a number of technology companies, including in your role currently. Can you talk a little bit about how, from a technology standpoint, a technology development standpoint, how you are helping to bring technologies into some of the emerging economies in the right way, because it's not just something that can benefit the Western markets. So it would be great to hear that perspective.
Yeah, absolutely. And assalamu alaikum. Thank you for having me here. I do want to also call out that in the West, healthcare is also really struggling. And a lot of people don't have access to good healthcare or really any healthcare. There are also a lot of places with food deserts where people don't have access to good nutrition. Or have access that is close to go to a hospital or a hospital setting with a specialist. So it's not just in emerging markets, it really is a worldwide global problem, and that's something that I've dedicated my time to, having spent some time at Google, is to bring technologies, including artificial intelligence. So it's wonderful to hear that you're using telemedicine and AI to bring the kind of technology into the hospital system and also make the hospital services accessible really worldwide. So some of the technologies that we brought in was, for example, using artificial intelligence to detect diabetic retinopathy. So diabetic retinopathy is something that is actually could be cured in a very simple way for the majority of people. But it is hard to well, it's actually easy to diagnose, but it's hard to get access to that diagnosis. So what we did is we designed a very cheap camera that you can bring in, and we deployed that in India, that you can bring in and use artificial intelligence, very simple artificial intelligence. The way we trained it is we took fundus images, which is the image of the back of your eye, and trained it, again, very simple algorithm to figure out whether or not a patient has diabetic retinopathy. And so that enabled whole villages and thousands of people to detect diabetic retinopathy at their location and prevent blindness, which is the major cause and a result of diabetes, which is now growing across the world. So that's one of the things that we're working on. Another is to take a lot of, and this is again where artificial intelligence, especially large language models, which we didn't have even 3 or 4 years ago, we were able to get access to electronic medical records, but without large language models, we were not, and we did not have the capability to design systems to make healthcare truly accessible to others. So as an example, we can now bring cutting-edge technology in cancer care or cutting-edge technology in diabetes care, in cardiovascular care from places like the Mayo Clinic or EPFL in Switzerland and others, and bring it really worldwide.
Thank you, Dr. Luba. I'd like to come back. I think this is a very important piece, which is how do you take technologies, ensure that you're getting the right diffusion across the global system to ensure that healthcare access is equitable across all countries, regardless of their stage of development. And I know, Dr. Manal, you've done this with some of the work you've been doing in healthcare in terms of taking an AI system off the cloud system and doing it in field, which I think, again, it's how do you take these technologies and ensure that you're getting that translation? And I think this comes back also to a question of capability development, right? How are we ensuring that there's also capability transfer into emerging economies? So as these technologies are coming out, that the access is truly equitable, the ability to leverage these technologies is truly universal, right? If we're going to bridge this gap between emerging and developed economies, if we're going to elevate healthcare for all, we have to make sure that the practitioners within countries are also capable of utilizing the technologies, are also capable of accessing technologies in the right way. I was part of a conversation yesterday where there was a discussion around potentially open sourcing technologies. I know there's some differing views on this, and there are pros and cons to it in terms of how you continue to spur innovation while still making technology accessible. I'd love to come back and talk a little bit about this. It comes a little bit to the policy environment, but I think it also comes to how nimble, how agile we can be in the face of a dynamic environment. Maybe Dr. Seth, maybe we can start with you on this. We spoke about this a bit yesterday as well.
So before I go into higher tech things, I want to go down to a lower tech thing. If you look at healthcare in the world, about 80% of conditions can be dealt with at the primary healthcare level. And one of the challenges is we don't do that, including in wealthy countries, as we heard, but certainly in poor countries. About 15 conditions account for 80% of the disease burden. And so as we think about healthcare, we think about something we call progressive universalism. You bring the most cost-effective healthcare to as wide a group as you can. As you have more money, you go to the next group, the next group, on your way up. That's how you get the best results. And so one of the challenges is if you're not thinking about that, if you're going right to the most expensive care or things that have the least cost effectiveness, then you break your budget without having an effect. Now, to me, where technology can really make a difference is it's expensive to make technology, it's expensive to test technology, but once you've validated it, it's not so expensive to get it out there. And I think that's what we're going to see. Let me give you another example that, I love on the AI side, which is you can now use AI models to look at how viruses mutate and change over time. So today, we look backwards. We ask the question, influenza, what was it in the southern hemisphere 6 months ago, and then how can we take those vaccines to use them now? But often the viruses mutate and those vaccines don't work anymore. We can use AI to go back and say, how do these viruses mutate? Where will they go in the future? And let's make vaccines for the future. Again, all countries don't have to do that, but what we have to make sure is if we make those types of products that they're universally shared, because prevention is the cost-effective intervention.
Thank you.
Can
Yes.
I add, actually, because I'd be very curious at also what you have to say. You mentioned, I like that you gave a case study. One of the things that we do, I wouldn't call it universal care, but we have Medicare Advantage, where it's kind of similar, where we try to manage a patient with a given amount of money by reducing costs, but improving outcomes. And we're doing that utilizing a lot of technologies, actually understanding, using AI to understand what are some of the most expensive diseases and how to triage patients and get to the patient before they get even sicker and use some of the diagnostics before. Can I ask you, is this, first of all, have you used something, have you used technology for Brunei? And do you think that in larger countries where there are a lot more people, we can use a similar system and apply it?
Yes, may I answer that?
Yes, please.
Thank you. So I think for healthcare to be resilient, there must be two things. First is the establishment of primary healthcare. That's essential, I agree with you. Because that's the foundation for any country, because it's so expensive, everyone go to hospital. But the challenges with even big countries is human resource, the migration of these professional workers. So that's where AI helps, okay? And that's where our health information system, using the mobile phone, what we call Brew Health. So this can be our first line of defense or first care, okay? So if you have a simple symptoms, you just enter those, and this will triage yourself, okay? So you can either self-medicate, for example, if it's just simple flu, but if there is more serious than that, then you go to the respective primary care or accident imaging. So in a way, it helps to triage the patients. And I always have this argument with Minister of Finance, the investment initially expensive, but like I said, but it's not expenditure. So this investment in technology is an investment. So I believe the dollar spent in this investment is a $10 saving. Because if you can screen them early, you'll have to manage this patient. And not only that, with this technology, we're able to do national screening much more effectively. Rather than they go to primary care, they can just do the screening through the phone, okay? And it selects itself, and you go to the centers where they do the screening. So for us, this early detection and prevention is the key to help to sustain the healthcare costs. Because as you know, with the aging in process and the healthcare, it costs more, and some countries even almost their military budget, you know. So for a small country like us, we also have limited resources, so we have to manage this healthcare cost now before it escalates. So we use this AI technology or this digitization to help us to maintain the cost so that there doesn't, burden the next generation.
Dr. Manal, I'd like to hear your perspective from a humanitarian standpoint on some of the topics that Dr. Isham has just raised. How are you leveraging the same kinds of philosophies and approaches in humanitarian provision of healthcare in the countries where you're currently working with Noor Foundation?
Well, when we first plan to use technology in our programs, it's never meant to be replacing an existing service or an existing job. We incorporate technology into our work, into our programs to support the existing manpower that's available. So we increase accessibility to good quality care with reducing the cost so it becomes more efficient. And we do that through proper planning and through partnering with the stakeholders, specifically the governments, the regulators, and the actual people on ground, the doctors, the nurses, and the paramedics. There's a lot of training that happens, and we also work with them on revising the customer journey in order to make it simplified, because we've seen in many instances where AI is introduced into a service and it makes the customer journey even more difficult or longer or less accessible. So we try to always make sure that the number one beneficiary is the customer, who is the patient in our condition or in our case. Then the second beneficiary is the person who's providing the service. And that's how we keep monitoring, although after we're finished with our installation, our work, we hand over the work to the local government, but we work with them for another 6 to 10 years. So if there are any new advancements are introduced, and we also monitor how is the technology being used in the proper, efficient way. We use the similar AI for diagnosing diabetic eye disease in several countries, and it has been a very successful program. We also use the results to actually measure the impact that our program has on multiple SDGs, and we report the results to the countries, so they see that there's an economic impact, there's a social impact, and also there is a gender equality impact and climate change. For example, our program in Nepal, the teleophthalmology, we have managed to reduce the carbon print because we've reduced the unnecessary referrals and the commuting from villages to cities. And presenting a government with such reports and showing them the positive impact that introducing technology had on their national SDG, I think that would encourage any country to adapt the technology into its services.
Yeah. Yes, please.
I just add one point, because I think technology, you've heard from everybody, we're all technologists, we're enthusiastic, but technology is also one of the major barriers and problems. And we have to keep this in mind, because we're also living in a world, a pandemic of misinformation. And the challenge is once you have algorithms that you can go to, you want to make sure they're accurate. You want to make sure that the information that the population is acting upon is well done. And we've had a loss of trust of institutions, of healthcare workers, of experts, and this is being inflamed by the system. So in one sense, this is the hope of technology, but at the same time, there's enormous risk with using it. And we have to make sure that we're validating and fighting that risk while making the technology available.
Yes, please, Luba.
Sure thing. I'm glad that you brought that up, because I wanted to note that I think that's actually the biggest challenge for governments, and is to figure out where is the line. Do you overregulate this or do you underregulate? So as an example, we love the triaging system, or the support and diagnosis, for example, that you can do it automated, which is called differential diagnosis by AI. But in order to get that approved, you have to actually go through multiple levels of approval, because the AI system is replacing a doctor or augmenting a doctor as an agent to the doctor. And that can take years and years and a lot of data. So I completely agree with you and your point. I think it's, and I'd love actually your thoughts, is, where do you think government should stand? Should they overregulate and require a lot of testing before it can be deployed, and be curious where you are?
Yes, so if you can answer that question, then we're just about to wrap up.
All right. Yeah, for our government, we make it as a living document. We validate it at certain intervals to ensure they're correct. Okay, yeah. And the beauty of, for example, diabetic retinopathy, if your human resources are so limited, it managed to free them up. Okay. This with a simple camera, anybody who uses the computer can manage it first as a first line. So the ophthalmologists will only see the ones that worth referring. So it frees up them to do more of the actual job rather than see this normal retinopathy.
Yeah.
So it's especially for a small country where human resources is challenging. So it helps us a lot.
I think the reality is, in today's healthcare environment, human resources are a challenge across the board. Dr. Manal, please.
And if I might just add,
yes.
I agree with everything that was mentioned, but the validation and the verification happens at multiple levels. So we validate the sensitivity and the specificity, and then there are pilot studies that are done and publications before we actually open it up for the services for the population. And it can happen, mistakes can happen, specifically with the use of AI, but we overcome these challenges, we learn from our experiences, even our mistakes, and we move on.
Yeah. Yeah, and I think this is a big part of it, right? The constant evolution of the medical community in step with the technology evolutions that we're currently undergoing, which are more and more rapid today. I'd like to just close in our last couple of minutes by asking each one of you, and we didn't have a chance to touch on the financing landscape, which is obviously a topic of great importance right now as that is changing. But as we close, it would be great to hear from each of you just sort of one key thought on where innovation has the most critical role to play, whether it's from a policy standpoint, a technology standpoint, a financing standpoint. How are we going to continue to make positive steps towards closing the gap in healthcare provision on a global basis, using innovation or technology in each of these areas? So if each of you could share just one thought on that to close for our audience, that would be wonderful. Seth?
So I think, the critical issue on health is there is no limit to the amount that can be spent on it. After all, if you don't have your health, you don't have anything. So why not just spend more? Well, the answer is it has to be spent well. And so this concept of cost effectiveness and thinking about it and having the algorithms to do that is absolutely critical. And the same thing on technology. How do we make the technology cost effective and available?
Thank you. Dr. Manal?
Yes, I agree with that. And if I may just add one point, I would add that it has to be adapting to the culture. Every country is different. The cultures are different, and if we, as a foreign NGO, go into a country and we do not adapt to the culture, an existing culture, then there might be resistance, not only from the people, but also from the employees who we're training to adopt that service into their work. So I think respecting the culture and accepting it and making it part of the program is a key factor in the success of the program.
Yeah. Thank you, Dr. Manal. Dr. Hisham.
I think we should embrace it, okay? And then it has its challenges, but first of all, it must be regulated and validated, especially at your national level, at your own population. And I wish that one day it will be open source for everyone so that everyone have equal access to healthcare.
Thank you.
Just to add, completely agree, and I agree with adoption and the culture. It's fundamental, and also the lack of resources. So if you have the lack of resources, I would say that the winner in the next 5 years is going to be agentic AI, so using agents to augment it doesn't even have to be a physician. It can be a healthcare worker that really understands the culture, that really understands the cost, is out there together, augmented by some of the tools that have been validated. And also checking, I love that here in Dubai and UAE, you're holding yourself accountable. And you're constantly checking, are you truly increasing outcomes with all the technology that you're deploying? So if you can have that, you have the agents plus the measuring of the outcomes, and you're given a certain cost per person that has really worked in many countries to treat a patient. That probably would be a winner over the next 5 years.
Thank you, Dr. Luba. And I'd like to thank all of you for your deep insights this morning, and to the audience for your attention. I think this was a fascinating look at how innovation and technology is going to be a critical driver in the provision of healthcare in the future and in achieving SDG 3 and beyond. So I thank you all for your time and your expertise, and we'll close with that.
Thank you, Elena.
Thank you.